Welcome guys to my head and neck playlist. Today we'll be talking about specifically the scalp. So in my last video we talked about the bones that forms the skull. We talked about that already, which we divided them into cranium and the facial skeleton. The cranium, the one that's from the skull vault, that is covering the brain, while the facial skeleton one that is covering the organs around the face. So we talked about all of them and I know you have understood them. So now we are talking about the scalp. What is covering the skull vault? So it's just like a clot I have, because if you strip out the scalp, now you see the skull. So now the scalp is a soft tissue covering the skull vault. So the where your hair is now, where your hair is oriented now, that is your scalp. So if you remove that scalp now during surgery, they have to do a circular incision where they remove the scalp so to expose the bone. So if you remove the scalp, you see the skull. If you drill through the skull, remove the skull, you see the brain. You get it now. So that is the scalp, just a covering of the skull vault. And now, where is it extending from? So it's extending anteriorly in the superior axillary arch, the superior ciliary arch. Now, what is the superciliary? What is the superciliary arch now? The superciliary arch now is just a representation of the eyebrow. The skull, you can see the superciliary arch in the skull. Now, when you are watching my normal frontalis video, you are seeing where you have your superciliary arch. See, now in the center of your two superciliary arch of your two eyes, now you have the word gabella. So if you watch my normal frontalis, you see that the gabella is oriented at that part. So in between the superciliary arch. So it's on top of the orbital, the orbit. You get nice part of your orbit bone. So your orbit bone, now you see the orbit, then on top of the orbit, which is your eyes, you see the eyebrow. That place where your eyebrow is your superciliary arch. So it's coming from your superciliary arch in the front, and now you're going to be superior noctural line at the back. Now the superior noctural line, you also watch my video on the normal occipitalis. So you can see the superior noctural line in the normal occipitalis. So in the occipitalis, you have your highest noctural line, you have your superior noctural line, you have your inferior noctural line, you have your external occipital protuberance. You get it now. So go watch the video. So it's extending from the superciliary arch to the superior noctural line at the back. You get it now. So by the side is attaching to what we call the superior temporal line. So you have the superior noctural line at the back, you have your superciliary arch in the front, and you have your superior temporal line by the side. So the superior temporal line is on the temporal bone. Are you getting me now? And it continues with the zygomatic part of the temporal bone. So that zygomatic part is the one that attaches to the zygomatic bone. So watch my video very well, so you're going to understand it. That's why I made the bones first before I enter the scalp. You get it now. So in front, superciliary arch, at the back, superior noctural line, by the side, superior temporal line. So that is the extent of the scalp. You get it now. So it's covering the skull vault, so don't forget it. Then the layers. What are the layers of the scalp now? Very, very important. What are the layers of the scalp? Now you follow the name scalp. Scalp is just a mnemonic. Scalp, from superficial to the scalp. So what is the first thing you see in the scalp based on the mnemonic using scalp? SCALP, scalp. That is the mnemonic. So that is from superficial on top to deep. So what can you see superficially? You can first see skin. Skin. After skin, what can you see? Connective tissue. The connective tissue forms the superficial fascia, because naturally when you remove the skin, you are seeing the superficial fascia. So after the skin is the superficial fascia. Or now inside the superficial fascia, I see a connective tissue by the mnemonic scalp. SCA. What's a? Aponeurosis. So what's the aponeurosis there? It is formed by the muscles and their aponeurosis. So what's the muscle? Occipital frontalis muscle and its aponeurosis. So SCA, skin, connective tissue, aponeurosis. L is for loose areolar tissue. This is a very, very clinical important area too in the scalp. After loose areolar tissue, you have the pericranium. So you have skin, connective tissue, aponeurosis, loose areolar tissue, and you have your pericranium. So if you use the mnemonic scalp, it's much more easier. Now, first of all, picking the skin now, you should know. So that place you used to, for boys, I used to use clipper to barb, and the girls that plait the skin, you are plating the hair part of the skin. So you should know that the skin is very thick and hairy. So it is very, very hairy, very well. So it is thick and hairy. except from the forehead. Remember I say it's coming from the superciliary arch, so the forehead do not have what? Hairs. It is thick and hairy, with the forehead not having a what? Hair. Are you getting now? So the scalp contains what? Sebaceous gland. It contains what? Sebaceous gland and numerous sweat glands. So sometimes you can get sweaty from there. So just like the normal orientation of the skin now, you have a hair, you have a thickness white, but some places the skin doesn't have hair. But in the scalp, the skin has hair. It has hair follicles where your hair goes. You get it now? So the hair follicles contain melanocytes, which gives us our blacking part of the hair. While those those the Caucasian, those that are white, their hair goes white because they lack melanin. Get it now? So some people, their hair can be blonde, can be red due to the orientation of the melanin in their head. So some people do not have melanin, but if you have melanin, it needs to be black, or it can be red, because sometimes they are red part of melanin, so it could be red. But if it's white or all this albino, you are lacking melanin. So first of all, it's thick, it's hairy, it contains sebaceous and sweat glands. You get it now? It is connected to the superficial fascia. So important. So first of all, it is thick, hairy, and you get it, except in the forehead, containing sebaceous and sweat gland, numerous of them. And you get it, and it's connected to the word superficial fascia. You get it now? And that superficial fascia is called the connective tissue, dense connective tissue. You get it now? So since we have known it now, so but you cannot see hair in the sole of the foot and the palm. So if you go to my upper limb video, you see. So I'm trying to give you some very important wordings there, so that you can understand it. Okay now. So they are about, if you want to know the hair follicle, there are about 120,000 hair follicles there. Okay now, and you are losing up to 20 to 100 hair follicles every day. Okay now. So some people can be bald without hair. Some people can be bald. So this is when the hair follicles are not what producing hair more often. So the next one is the connective tissue layer, which is the superficial layer. So you can see it now. The connective tissue layer is just the superficial fascia, which is made up of what? Dense fibrous connective tissue. That is what connecting the skin to the what? Aponeurotic layer. So the superficial fascia, or the dense connective tissue layer, is doing what? Is connecting the skin to the what? Aponeurotic layer. And the aponeurotic layer is called the occipital frontalis what? Muscle, and its aponeurosis. So get it now. The skin is on the superficial fascia, or the connective tissue layer, while the superficial or connective tissue layer is joining the skin to the aponeurotic what? Layer. So very important. It has what we call a fibrous septum. So in the superficial fascia, remember, superficial fascia usually contains fat, very well, a smaller pocket of fat. So naturally, for anatomical wise, you should know by now that if you remove the skin, you are seeing your superficial fascia. If you remove the superficial fascia, you see your deep fascia. If you remove your deep fascia, you see your muscles. So that is how the orientation of the anatomy of the body is. You get it now? So inside this superficial fascia, we could see pockets of what? Fat. You get it now? We can see pocket of fat, and you can see cutaneous blood vessels and what? Nerves. Cutaneous blood vessels and nerves. Because you also have some deep blood vessels, but this one you have your superficial blood vessels and nerves. So that's why when you cut the skull now, maybe when you cut the scalp, you see blood. Why do you see blood? Because you are cutting the what? Blood vessel. Yes, now this wall of the blood vessels are adherent. They are what? Tighten on this what? Superficial fascia. So when the blood vessel is torn during any injury, what happens? It is unable to be retracted. That causes what? Profuse bleeding. So they are placed on the superficial fascia directly. So if you cut it, the bleeding will be enormous. It cannot stop. You get it now? So you can only stop it by pressing the scalp down. You can press it by pressing it to the bone. So if you press it to the bone, you stop the bleeding. You get it now? So very simple. So I've talked about the skin, I've talked about the superficial fascia or the connective tissue fascia. Now the aponeurotic, next is the aponeurotic layer. The aponeurotic layer is formed by the occipitofrontalis muscle and its aponeurosis. You get it now? So now if we should know what the occipitofrontalis muscle is, just occipital muscle and frontalis muscle. Very important. So they are meeting in the middle, called the what? Aponeurosis, or you can call it the epicranium aponeurosis. So the frontalis muscle, occipitalis muscle, we meet in the middle, forming a what? Aponeurosis. So the frontalis muscle now is originating from where? It has two belly. It's originating from the front, the eyebrows, just the skin and the subcutaneous around the eyebrows and the root of the nose. So it's coming from the superciliary arch side and the root of the nose and the forehead. It comes from the front going back, so it is two belly of muscles coming from this side, the front side of the hair. You can see it there, coming from the eyebrows, the nose and the forehead, going back to meet the occipital muscles in the middle. You get it now? But they have no bony attachment of their own. No, they have no bony attachment of their own. Now the next one is the occipitalis muscle. Where is it coming from? It also have two belly, just from where the origination is. Naturally, where the scalp is coming from, that is where these muscles are coming from. In the back now, the occipitalis belly is coming from the superior noctural line. So it's coming from the superior noctural line, two of them, and it's also inserting in the middle. You get it now? So when I come from the back in the superior noctural line, which is at the back, which I said before, so it's coming from there and meeting the frontalis muscle in the middle, forming an epicranial aponeurosis. So the front is coming from the superciliary arch and the root of the nose. And now they are subcutaneous because they pass the forehead. When they pass the forehead, they meet the occipitalis muscle in the middle. So that middle they are meeting is called the epicranial aponeurosis. So muscle layer, but the muscles are oriented subcutaneously. They are oriented on the skin, so to meet it in the middle. You know, so it's very, very easy. It's not hard. Frontal belly is coming from the front, occipital belly is coming from the back, forming an aponeurosis in the middle called the epicranial aponeurosis. So the skin contains so the skin is thick, contains hair follicles, contains sweat gland, and contains sebaceous gland, and it is resting on the superficial facial or connective tissue layer. The next one we said was the superficial or connective tissue fascia. What does it do now? It does what? To orient the skin to the aponeurotic layer. So it is attaching the skin to the aponeurotic layer. It contains fat and cutaneous blood vessel. So the blood vessel are attached to it very well, that when you cut the blood vessel, the bleeding is enormous, but you have to press it on it in order to stop the bleeding. While the aponeurotic layer contains muscles, occipitofrontalis muscles, occipital from the back, the superior noctural line, to belly, and the frontalis muscle from the front. Yeah, so it is very, very important. And the nerve supply here is still the same thing, which I'll be giving you the facial nerve. So when I give you for muscle or facial expression, you are going to see. So the temporal branch of the facial nerve is supplying the frontalis muscle, while the posterior auricular nerve of facial nerve is supplying the occipitalis muscle. Again, now, so one thing you have to know, that the terminal branch of the facial nerve up, so it divides in the ear. It divides in the ear. The one going in front of the ear is the temporal branch of the facial nerve. You get it now? Why the one that is going to the back is the posterior auricular branch of the facial nerve. Posterior auricular, back of the ear. Auricle is the ear, back of the ear, posterior auricular. You get it now? It's so simple. We got the terminal branches of the facial nerve. You can see the cervical branch, you can see the marginal mandibular branch, you can see most of the nerve. We'll talk about them. I just don't want to talk everything about them now. So important. So now what action does it do? So if you go to my muscles of facial expression, I'll explain them very well. You get it now? Because they are acting above. When you contract the frontalis muscle, it raises the eyebrow. The frontalis muscle usually indicates it causes what we call transverse oriented. So if you transverse, when you put your head up, you are surprised, you see this demarcation in your forehead. So that demarcation is acting as if so transverse wrinkling of the forehead, showing surprise. Transverse wrinkling of the forehead showing surprise. So it's very, very important. So also the occipital muscle can get folds too. The occipital belly too can get folds sometimes. So when you are orienting, you are pushing your forehead back, when you're acting surprised. So you are using your occipitofrontalis muscle. So don't forget it for your exams. Now you have your loose areolar tissues. Now the loose areolar tissue is after the aponeurotic layer. Now it's after the aponeurotic layer. It contains only loose areolar connective tissue. So this layer now is under. So remember, I say from superficial to the skin, connective tissue or superficial fascia, aponeurotic fascia. The next one is loose areolar connective tissue. It just contains loose areolar connective tissue. Finish. Yeah. So when it serves as if now for surgeons now this part serves as a natural plane of cleavage. What's natural plane of cleavage? This area is very free. There's nothing there. because it's just little loose areolar tissues that are there, so it's just freely, it moves freely. You get it now? For surgeons, it's usually much more easier. This area is just a free plane there. Are you getting now? And one problem is that it is connecting a mesenteric vein. So now remember, I say in the second layer you have your what? Subcutaneous nerve and vessels. Now you have your subcutaneous veins there, which we'll be talking about in the blood supply. You have your subcutaneous veins, and that subcutaneous vein is connected to the what? Venous sinus. We have your intracranial venous sinuses. The last part of the scalp is called the pericranium. Are you getting me now? So after the pericranium, you can now see the skull. The skull is called the endocranium, or you can call it the endosteum. So this we are talking about is the periosteum, because it's the last part of the skull before it touches the what? Skull now. Yeah, so it is the last part of the scalp before it touches the skull. So the skull is the endosteum of the bone, while the last part of the scalp is called the periosteum of the bone. Are you getting me now? Now that is where the loose areolar tissue. So it is after the loose areolar tissue. It is loosely attached to the bone and can be easily stripped off. You get it now? So you can easily, during surgery now, I could easily strip this part off because it's a scalp. So I could just remove it because you can easily remove it. But the only thing that at the areas of the suture, are you getting me now? It is held very well at the areas of the suture. So remember, the pericranium is attaching directly to the endocranium or the endosteum, or periosteum on the endosteum. So the only thing that you can easily remove it except from the areas where they are suture. So go to the bones that forms the skull. You are going to see the sutures there: coronary suture, sagittal suture, and all of them, rhomboid suture. So you go there. So on the areas of this suture, it is what? Adhere very, very well. You get it now? So the next one is the what? Blood supply. So what is the blood supply to the scalp? The blood supply to the scalp, so easy. Okay, now. So first one, you can see the one coming from the front. The one coming from the front, you see two coming from this front, just at the eye side, just the eye side. You have your supratrochlear and supraorbital arteries now. Supratrochlear and supraorbital arteries, very, very important. So these arteries are also important. Why? Because they are supplying the what? Scalp in the front. Okay, now, so supratrochlear and supraorbital artery is a very, very important artery to the scalp, because now this place, now they enter into the supraorbital artery enters into the supraorbital notch. Okay, now the supraorbital artery enters into the supraorbital what? Notch. Supratrochlear, supraorbital branches of the ophthalmic artery, so they supply in front of the scalp. Now the superficial temporal artery is supplying in front of the scalp. The superficial temporal artery. The superficial temporal artery is a branch of the external carotid artery. It's a terminal branch of the external carotid artery, which is the superficial temporal artery in front of the scalp. Yeah, I told you 3 at the front of the ear, 2 at the back of the ear. Get it now? The first 2 is supratrochlear, supraorbital artery in front of the forehead, just in the eye region, going to the back, which you are seeing. Superficial temporal artery is in front of the ear, a branch of the what? External carotid artery. Posterior auricular artery is at the back of the ear, like I said. Posterior auricle, back of the ear. Posterior auricular artery supplies the back of the ear, a branch of the external carotid artery. Now the occipital artery now is another branch which is at the back of the skull, at the back. Yeah, the occipital side now, that one is also a branch of the external carotid artery. So it's very, very important. So remember, POSSS. Now what is POSSS? Or you can know POSS. So triple S now. The first P is posterior auricular artery, back of the ear. Occipital artery at the back of the head, at the occipital region. Superficial temporal artery in front of the ear. Supratrochlear and supraorbital artery in front of the forehead. So I've given you which branches they are from. But so 3 here are branches of the what? External carotid artery. Yeah. So the next, now the veins now is corresponding to the same thing now. The same vein, the same artery you call is the same vein now. So it's the vessels. So you have the supratrochlear and supraorbital vein. Supratrochlear and supraorbital vein. You see it now. This supratrochlear and supraorbital vein forms an angle with the eye draining into the angular vein. So both of them forms an angular vein in just, you see that place in the middle part of it where your tears drains to. I don't know, if you put your hand in the middle of your eyes, just in the 2 parts of your nose, like that part of your eyes that is bordering your nose now, that is where it forms the angular vein. Get it now? That's the one, that part that if you wake up in the morning, that place death used to be, something that is like that forms is forming in that middle part of your head. At that part that is in between, so your nose is in between them, so they are just two in the middle part of your eyes now. That is where the angular vein is located. So the angular vein now drains to what we call the facial vein. So later I will talk about it. So supratrochlear and supraorbital vein drains into the angular vein. They form the angular vein. Now the superficial temporal vein drains into the what we call the retromandibular vein with the maxillary vein. So the maxillary vein and the superficial temporal vein drains into the retromandibular vein. But in the artery, the superficial temporal artery is a branch of the external carotid artery, the terminal branch, together with the maxillary artery. So important. Why the supratrochlear and supraorbital arteries are branches of the ophthalmic artery, but their veins drains into the what? Angular vein. Now, the next one here is the posterior auricular vein, which is at the back of the ear. That one also drains what? Into the posterior division of the retromandibular vein. So when it joins the posterior division of the retromandibular vein, they form the what? External jugular vein. So the last one is the occipital vein now. The occipital vein terminates in the suboccipital venous plexus. So it doesn't drain into the external jugular vein. So it forms its own venous plexus. You get it now? So remember POSSS. POSSS for arteries and vein. So the nerve supply, we have some sensory branches and we have some motor branches now. For the sensory branches to the scalp, you have 8 of them. 4 in front of the ear, 4 at the back of the ear. 4 in front of the ear, 4 at the back of the ear. So that is the nerve supply. In front of the ear, you call it zags. Zags for short. Now, which I'll be giving you. Why 4 at the back of the ear, you have some of them, which we'll talk about. Why in the motor now, the motor has what I told you, that is the temporal branch of the facial nerve that supplies the frontal belly. The temporal branch of the facial nerve forms the frontal belly, while the posterior auricular branch of the facial nerve supplies the what? Occipital belly. Don't forget. So that is for the motor. The motor innervation, which we have talked about before, is to the muscles in the aponeurotic layer. You have the temporal branch of the facial nerve for the frontalis muscle, and the what? Posterior auricular branch for the what? Occipitalis muscle. So the motor supply to the aponeurotic layer, or the motor supply to the scalp, is from the facial nerve, which is the terminal branches of the facial nerve. Don't forget to motor supply is the terminal branches of the facial nerve. But the sensory branches now is divided into 4 in front of the ear, 4 at the back of the ear. Now in front of the ear we call it zags. What is zags? Zygomaticotemporal branch. Zygomaticotemporal branch, Z. The zygomaticotemporal branch is a branch of the what? Zygomatic nerve, which is also a branch of the maxillary division of the trigeminal nerve. So if I teach you the nerves that to the head and neck, you are going to see it here. So in the trigeminal nerve, you have a maxillary division. In the maxillary division, what happens? You have a zygomatic nerve. In the zygomatic nerve, you have a zygomaticotemporal nerve. A auriculotemporal nerve. ZAGS. ZASS. A auriculotemporal nerve. The auriculotemporal nerve is a branch of the mandibular division of the what? Trigeminal nerve. While the zygomaticotemporal nerve is the maxillary division of the trigeminal nerve. So ZAGS, you get now, ZAGS, zygomaticotemporal, a branch of zygomatic nerve, a branch of maxillary division of the trigeminal nerve. While auriculotemporal nerve is a branch, which is a terminal branch of the mandibular division of the trigeminal nerve. S, supratrochlear and supraorbital. Supratrochlear and supraorbital. Like I always say, supratrochlear, supraorbital, they are from the ophthalmic. If it's for the arteries, it's from the ophthalmic artery. If it's from the vein, they form the angular vein. You get it now? Now for the nerve, they are from the frontal nerve, or the frontal branch of the ophthalmic division of the trigeminal nerve. Usually they are in front of the ear. They are branches of the what? Trigeminal nerve. At the back of the ear now, the first one you can say at the back of the ear, just immediate, is the great auricular nerve. The great auricular nerve is from the ventral rami of 2-3 of the cervical nerve. So C2, C3 from the cervical nerve plexus. C2, C3. The great auricular supplying the back of the ear directly. After the great auricular, you can have the next one that is following the great auricular, which is what? The less occipital. So the less occipital is from C2 the ventral rami of C2. While the great occipital is in the back of the head, is also derived from the dorsal rami of C2. So less occipital is from the ventral rami of C2, while great occipital is from the dorsal rami of C2. Yeah, now. The next one is the third occipital. You can see it in the occipital part at the back of the head. Yeah, third occipital. You are seeing it on your screen. The third occipital is from the dorsal rami of 3. Dorsal rami of 3. Get it now. So the great auricular is 2 and 3. The less occipital is only 2, or in the ventral rami, while the great occipital is dorsal rami of C2, while the third occipital, which is dorsal rami of C3. So I hope it's all making sense for you. ZAGs and GLGT. ZAGs and GLGT. Now what is GLGT? Great auricular, less occipital, great occipital, third occipital. Okay, now don't forget it. Now the clinical effect here is now remember I told you that the part that is very shifty and the part that usually gets damaged is the emissary vein. So the emissary vein gets damaged easily. Why? Because it can form what we call the black areas of the scalp. Get it now? It can form the dangerous areas of the scalp. So the dangerous areas of the scalp is called the loose areolar tissue. So why is it called the dangerous areas of the scalp? Because if the emissary vein are cut, what happens? It gets clot and it start moving around that side. You get it now? It start moving around that side. So when the emissary vein is damaged, you get it now, what happens? It gets clotty and it start moving area because that place is very free, so it moves around that side. And infection too can travel. Yeah, infection can travel along this area too. So when infection travels of the blood clots, it can form what we call a thrombosis. So if they ask you what is the dangerous area of the scalp, the dangerous areas of the scalp is the loose areolar tissue. Get it now? So simple. Now, and that one again, now the surgical layer of the scalp, like we always say now, the surgical layer of the scalp. Now you have the first 3 layers, which is the skin, connective tissue, and aponeurotic layer. You get it now? So now these 3 layers now are firmly adhered together and cannot be separated. So these 3 SCA, they cannot be separated. Are you getting now? So they are called the scalp proper. So when you remove it, remember, because the loose areolar tissue is a free area. Are you getting now? So nothing is there. So the 3 layers SCA they are called the scalp proper because they are removed during a surgical craniotomy. Yeah, so in surgery now you have to remove that layer to expose the loose areolar tissue. So it's a free plane that if you damage the emissary vein, what happens? It can form clot and move around that area. So I hope it all made sense to you and you have understood everything I've talked about today in the scalp. Started the scalp to be the covering of soft tissues on the scalp vault. So the covering of soft tissue on the scalp vault is called scalp. And I give you the mnemonic SCALP, which is scalp. Scalp is also the mnemonic for the layers. You have the skin, which contains what? Sweat gland, sebaceous gland. It is very, very thick. It's very, very thick and attached to the superficial fascia. Sometimes the skin shows that it can be infected. So it can be what we call sebaceous cyst. It's a common area in the scalp, the skin. So in the connective tissue or superficial fascia, what happens? It contains fat, very well, fat and cutaneous blood vessels, which when you cut it transversely, it could bleed profusely, but you can stop it by pressing it against the cranium bone. The aponeurotic layer contains muscles, which is the occipitofrontalis muscles. The occipitofrontalis muscles is from the superciliary arch in front and from the superior neutral line at the back. Then the meeting an aponeurotic point in the front. The loose areolar tissue is just a free area. Contains loose areolar tissue, which is the free area of the scalp where injury can also occur due to a blunt force trauma to the head. Cuts the emissary vein. When it cuts the emissary vein, blood can be moving freely in that area, which can also cause black eyes, thrombosis, or infection. Now, the pericranium is that area that is attaching to the endocranium of the bone, which is attaching to the skull directly. So I hope it all makes sense to you. You have understood. So we have did a detailed anatomy on the scalp very, very well because I explained everything for you to understand. So if you are new to my channel, make sure to subscribe and turn on your post notification button so that anytime I drop any video, you're sure to be notified. So if you want me to make a video for you, put it down in the comment section. When I see it, I'll make that video for you surely. So I'll be seeing you in my next video, which is what? The face. Don't forget. Bye bye.